Okay, so just a quick video with some adductor options. I've got a little bit of protective tone around my left adductor. Gaelic football training yesterday. Opened up a little bit of sprinting, and just got a little bit of grabbing in the left adductor. So I'm just going to go through some movement options here and just open your mind a little bit and just give you some potential options that you can use with your athletes. So one of the first things we'll do, so again, the normal adductor stretch as such is this. Now, when you stretch your adductor, I want you to think about a couple of things. If I leave my big toe come off the floor, that naturally is going to get an internal rotation of the femur. If I keep my little toe pushed into the floor, that almost gives me the opposite of almost an external rotation of that knee. So that adductor is going to externally rotate. Okay. Now, if I want an internal rotation, then maybe I want to let my little toe off, but that's up for yourself to decide. So this is your usual stretch where you're just going to lengthen the adductor. Now, the adductors obviously are going to continue the fascia, etc., the skin, etc. It's going to go across the body. So one way that we can lengthen this adductor and decrease some protective tone is to use our hands. So as I go into that stretch, what I might want to do then is actually lengthen that adductor more by just reaching this hand this way. Okay, so that's going to lengthen the tissues a little bit more in the transverse plane. Okay, so if you think of sprinting as I drive through, okay, as this comes through, that adductor is going to lengthen with the hip extended in the transverse plane. If I want to do a little bit more hip extension in the sagittal plane, I'm just going to put the foot slightly forward, go back into that stretch, and now I'm going to get a little bit more almost hip flexor type adductors. Okay, so that's a transverse plane. If I want to really drive it more in the frontal plane, I can just do this. So that's going to get a lot more. I can feel that protective guarding a little bit there. And then if I really want to increase it, I can just put my hand up, and then that's going to really lengthen it in the sagittal plane as well. Or I can combine the two actions, or I can get a little bit of transverse plane, a little bit more sagittal plane as well with that. Okay, so there are some options for your athlete. That's a nice little kind of warm up before they go back into their session. So again, tomorrow night, I'm going to be doing a lot of that just to help that tissue lengthen in any which way, because it's usually this position where, you know, if you're rugby or you Gaelic and they really have to twist, that's usually what will kind of irritate the groin, so to speak. Okay, so that's just some options. I want you to give those a try. And I want you to think about other ways that you could maybe lengthen these tissues and decrease the protective tone. You know, something that I talk a lot about in the mentorship is, and what I'm going to start to talk a little bit in the new grad side as well, is the power of the breath with this. So if I'm doing this kind of movement and I'm lengthening that tissue, the one thing that I want to make sure that the athlete's doing is breathing. Okay, so I don't want them to hold their breath and really rag it. Okay, we want to give it a non-threatening stimulus. So that's where, as you inhale and you reach, you might be able to get a nice lengthening as you inhale there. So as you inhale, that's just going to encourage the brain, combined with the breath, to show it that it's safe. Okay, so again, I might use some nasal breathing, or we might use some other different strategies as well, just to make the athlete's nervous system feel safe. Okay, the last thing you want to do is put them to end range and then just start ragging it. Okay, because again, you want to consider what's that athlete's nervous system thinking when that is actually taking place, where it's a very smooth movement, I'm just going into it for 2 seconds, then it's a very non-threatening stimulus. So I want you to think about that as well with all your rehab exercises. Is that athlete's nervous system seeing this as a threat, or is it seen as reassurance? Okay, so all I'm doing here, I'm restoring, reassuring the ability of these tissues to lengthen in pretty much all different planes. So try that for the adductor. And again, you can pretty much do this for the rest of the body, and over the coming weeks and months, we'll start to explore some other different variations as well.